cheerful heart is good medicine, Proverbs 17:22. This is Robin again. I just want to update you on my Acinic Cell Carcinoma radiation therapy. This is going to be over covering days 2 and 3, and this is right after day 3. So I've been going in for my radiation therapy, and what I noticed after day 1, about a couple hours afterward, I started getting a lot of jaw kind of, just pain, and a lot of this cheek radiating pain that I've been suffering with probably since the summer, which led to the whole diagnosis, which is good. So if pain can be happy, I guess that one would be a blessing. But I started having a lot of jaw pain, so I took some ibuprofen, and that seemed to calm it down, and I was able to go on with the rest of my day. Now, yesterday after my therapy, I noticed about 15 minutes afterward that the pain really hit me again, and so I took my 3 ibuprofen, and it didn't really do anything. So I have some hydrocodone left over from my surgery, so I took one, and then I felt some relief. So my husband and my daughter and I we're out to lunch at a really cool restaurant in Houston called Ruggles, and then we went to do a little shopping, and I was going to buy some summer hats, which I did. Let me show you. These are, I know you can buy them online, but these are from the MD Anderson gift store, and they are the SPF 50. So, do y'all approve? This is my favorite because it's one of my favorite colors. I could wear it Gilligan style. The other 2 are just basic colors, and they have a snap system. All of them are wide brimmed, and you can curl them if you want, or whatever. But they give a lot of protection. But again, all of the fabric is SPF 50, and I don't know if you can see on the inside, these are snaps so that you can put you buy, it comes with the drapes, the cloth drapes. So if you're out in the sun and you want more protection over your neck, then you can drape it, which is nice. So I don't know if I'll need any of that. I'm sure my doctors will say, yes, please do that. But I've got them because I plan on going to the beach this summer. But what I noticed while I was shopping, which is about a couple hours or so after lunch, the pain had really come back, and it had come back a little bit harsher. So I took a second hydrocodone, which that's my limit. I can take 2. And it's a baby amount. I mean, it's the smallest amount before you just go straight into acetaminophen or whatever. And it just didn't seem to knock it out. So the only recourse I had was really just to stop talking, which I have done before surgery when I complained about my TMJ getting so bad that there were a few days I just said, I'm done. I'm sure all the men in my life were like, yay! She's done with all the words for today. So I ended up deciding to go into the clinic, which is you go see your radiologist, oncologist once a week, unless just for a checkup. So he looks in your mouth, looks at your skin, and talks about any symptoms and how you're managing them. But if you are having problems in between visits, you don't call, you just go in. So my husband and I went in this morning, and we were able to see our physician's assistant and our oncologist, radiology oncologist. And he felt like, because I was saying, I think the pain that I'm having must be coming from the mouthpiece, because it's so thick. It's almost next to impossible for me to get it in my mouth, but thank the Lord, of course, it fits. So I was sure that it wasn't the radiation itself, but the treatment process of putting the mouth splint and then laying there with it, or lying there. I don't know. I never get that right. Lying on the table with that in my mouth for 15 or 20 minutes by the time they snap me in and snap me out, kind of thing. And so I was thinking, I need help though, because every day, 5 days a week, I'm going to have to do this, and I need some help. What do I need to do? It was his opinion, which I believe would be more correct than mine, that I get to be one of those rare ones. Again, I guess I get to be rare any which way it comes to this thing. I get to have radiation inflammation from the beginning. So we hadn't been told of that, or I didn't hear anything about that, or I would have guessed that from the first day that might be what it was. So I thought it was the TMJ issue with the mouth splint, and he said no, but he gave me a pain management plan. So if I go to sleep on you here in a second, you'll know it's working. So we're going to see today. I did the pain management plan, which was take 3 ibuprofen 30 minutes before treatment, and then I've got those 2 hydrocodones that I took 30 minutes afterward, and we will see if that manages the pain. It probably will do a lot of good because I'm just a little bit tired, so I may end up laying down and watching some more reruns. Well, for me, it's not reruns. How I Met Your Mother, which is a good excuse any day for me to watch that. So I may just rest my mouth anyway. So we will see. Now, for the silver lining of today, I will use a gift that was sent to me by some lovely, wonderful people that I don't know as well as I wish I did, or I will. But I do miss them a whole bunch. It's my friends at Meals on Wheels. And this, I'm going to try to show you. We wear plastic aprons every time we go in to do the food into the containers. We're on like an assembly line. And I really enjoy those. I go once a week. And so they made an apron for me where they've all signed it. So I'm going to try to show it to you. I don't know if it shows up or not, but these are all my friends from Meals on Wheels, and they've all sent wonderful messages. You know, I'm not a big cooker, but I may just have to wear this and pretend when I get home. So thank you for all of the love that not just my friends at Meals on Wheels, but everyone keeps sending me. So that's it for day 2 and day 3. I'll let you know tomorrow how the new pain management system is working, which I think it already is because I'm doing well so far. So I'll see you in the study papers.